Indian Medical Association, Medical Students Network, and Junior Doctors Association, Tamil Nadu State Branch, it gives me immense pleasure to welcome you all to today's inspiring webinar titled What It Takes to Be a Leader. This insightful session is proudly organized by IMA-MSN TNSB for the academic year 2026 to 2027 with a vision of shaping future medical leaders. I extend my respectful greetings to our esteemed state president, president-elects, state office bearers, patrons of IMA, our dedicated state team members, our respected guest speaker, faculty members, and dear medical students who have joined us this evening. The function of leadership is to produce more leaders, not more followers. To formally welcome our gathering and set the tone for today's session, I now invite Mr. Parthasarathi, Joint Secretary, IMA-MSN TNSB, to deliver the welcome address.
Very good evening to all present here. It's an immense pleasure and honor to invite each one of you to this wonderful and marvelous webinar. First of all, I would like to thank all the state leaders, Dr. Sridhar sir, President, IMA-MSN TNSP, Dr. Singituvan sir, Past President, IMA-MSN TNSP, Dr. A.K. Ravikumar sir, IMA-MSN TNSP, President-elect 2026. Dr. NRTR sir, NRTR Tyagarajan sir, IMA-MSN TNSP President-elect 2027. Dr. Thiruvia Mohan sir, State General Secretary, IMA-MSN TNSP. Dr. Solomon Zayal sir, State Finance Secretary, IMA-MSN TNSP. And over to our state team, Dr. Annamalai sir, Chairman, IMA-MSN TNSP. Dr. Jamuna Rani ma'am, IMA-MSN TNSP. Dr. Hari Aran sir, Chairman, IMA-JDN TNSP. Dr. Kannan sir, stand-in convener, IMA TNSP. And to over our student state leaders, Arnagiri sir, Bala Hariharan sir, Ajay Karthik sir, and Hariharan sir. Arnagiri sir, convener, IMA-MSN TNSP. Ajay Karthik sir, General Secretary, IMA-MSN TNSP. Bala Hariharan sir, co-convener, IMA-MSN TNSP. Hariram sir, co-convener, IMA-MSN TNSP. I would like to also welcome Dr. Josephine Latha ma'am, who is our chief guest today. And I would like to over to you, Shruti, for the chief guest welcome address. Thank you.
Thank you, Parthasarathi. Leadership is not about a title or a designation. It's about impact, influence, and inspiration. Today, we are honored to have with us a distinguished academician, visionary educator, and inspiring leader in the medical education, Dr. P. Josephine Latha ma'am, Professor and Head, Department of Biochemistry, Srinivasan Medical College and Hospital. With over 20 years of teaching experience and nearly 18 years of post PG mentoring, she has served in multiple prestigious institutions across Tamil Nadu. She is an MEU coordinator for CBME implementation and NMC observer, resource faculty for basic course workshops and ADCOM, organizer and plenary chairperson at national conferences including Ambicon and a dedicated postgraduate guide. She is also a government awardee recognized for her frontline service during the COVID-19 pandemic and for her unwavering commitment to medical education and public health. It is now time for the most awaited segment of today's program. I respectfully invite our esteemed chief guest, Dr. P. Josephine Latha ma'am, to deliver her address and share her valuable insights on the topic, what it takes to be a leader. Over to you, ma'am.
Good evening, everyone. Am I audible?
Yes, ma'am.
Yes.
Shall I start?
Yes, ma'am.
Ma'am, your video isn't clear.
Video. No, I have started my video, but I don't know why is it not visible. What should I do for that?
Ma'am, there is a share icon below in the
No,
lower.
I
video.
have opened the video icon, but it's not visible. Video icon is here.
No, ma'am, you have to share, ma'am.
Ma'am, no, ma'am. Actually, video icon is there. Ma'am, can you rejoin the meeting again, ma'am? Is it okay for you?
Yes. What should I do for that? You are sharing my video, right? You are sharing my PPT.
Ma'am, yes, ma'am. We are sharing we are sharing the PPT. Yes, ma'am.
But video is my video.
Ma'am, can you join once again, ma'am? In the meeting and join it once again. I guess
Okay,
that would be
okay.
okay. Thank you.
Now also not visible, I think. I don't know what happened to my video. Should I change any of the settings in my video?
Akash, can you please look into it? What was the problem? Ma'am is unable to turn on her video actually.
Yes, up arrow.
Ma'am, are you using a laptop, ma'am?
Yes, select a camera. Should I choose video filter? You want me to share, right?
Ma'am,
Yes. Only my video is not visible. What should I do for that?
ma'am, it's okay, ma'am. We should
Usually,
continue.
when video icon is open, it will be visible, right? Now my video
Ma'am, does
icon
your
is on only, turned on only. But it's not visible.
Partha, I think
ma'am,
it's
does your
go to,
laptop have a shutter, ma'am?
yeah, it may be having filter in
Camera
as
shutter.
an antivirus thing. Ma'am, is it okay, ma'am, to continue without video?
Okay.
Yes, ma'am.
So video filters none only. Sure. shutters, no shutters.
Ma'am, like it is a physical shutter which obstructs the. It is not a setting in the laptop, ma'am. In the camera module, there will be a shutter. If you click it to the other side, that your camera might be visible. Can you try that?
Over the camera. Over. No shutter.
Ma'am, I guess we can continue with the same now. Thank you, ma'am.
Okay, shall I start?
Yes,
Is
ma'am.
it
Yes, ma'am.
okay for you all?
Yes, ma'am.
Yes, ma'am.
Okay. So good evening, everyone. You are the future healers now, right? Young doctors and esteemed members of the IMA Medical Students Network. Thank you for your invite for this prestigious event. You are doing wonderful work. Thank you so much for having invited me for this speech. And thank you for your warm words of introduction. Now, when you look around you, many of you are first generation learners. Many of you have traveled from the heart of rural Tamil Nadu, battling immense odds, grueling your exams, and sleepless nights to earn that white coat. I hope everyone will agree with this. And you have been taught anatomy, pharmacology, biochemistry, surgery, OG, medicine, and a lot of other subjects. But today, we are going to talk about the one subject that is missing from your textbooks, that is leadership. But I am able to see a leader among yourself now itself. You are great leaders now since you have started this network that shows your leadership. Now we can see what are the leadership qualities that are very important now. We can move on to the session. Next slide, please. So today's topic is about what it takes to be a leader. From a doctor's perspective, the kind of doctor patients trust, the team's respect, and the society needs. So where I again welcome everyone and congratulate the students on making it to medicine, especially first generation learners. Now we can move on to see why leadership matters today. Because now the healthcare is evolving rapidly. It's more than just medical knowledge. And today's healthcare complex teamwork is mandate. Our patient needs guides, not only prescribers of medicines. And our system also need fixing, not just navigating. So being a doctor entails more than just possessing the medical knowledge. You all will agree now. It's today, it requires strong leadership skills, whether coordinating an emergency room team or managing a rural clinic, your leadership dictates patient outcomes. So now you can see a relatable scenario, the night duty. At 2 a.m., you are in the casualty ward and you are an intern now. And 3 critical admissions are simultaneously taking place. But your senior resident is scrubbed in OT and nursing staff is looking at you for your orders. And fear and panic set in at this situation. So, what will you do at this time? You should not panic, you should not fear, you should be calm and composed at this situation. That is your emotional intelligence. You should be aware of that. At this moment, medical knowledge is not enough. You need decision making, calm communication, and teamwork. That is the leadership in action. Next slide. So, what is the hardest part of internship? Can I have a poll? No QR code, it seems, right? It's not working. Is it working? You can give your thoughts in the chat box. What is the hardest part of internship? Either the shifts and exhaustion, dealing with angry attenders, managing nurses and technicians, fear of making clinical mistakes. Which one you feel the hardest part? So most of you only A and D are becoming the answers. So shifts and exhaustion. All A, B, C, D. One of you have given all the four to be your stress. So most of you feeling stressed by your 36-hour shifts and exhaustion. B. Only one of you have given the answer, dealing with angry attenders. Okay. So you are feeling your shifts and feeling exhausted by doing so much of work and dealing with angry attenders. So here you should give importance to your emotional intelligence. So we should train ourselves for that. And this 36-hour shifts and exhaustion, you should try to convey. You should be able to communicate what is your stress level. And then appropriately finding a solution. Right? So next we can see the various dimensions. And after finishing off all these slides, you will be able to give me the answer, how you can manage all these hard part of the internships, how you will be able to manage these stress levels. So next we can move on to the self-leadership. So the dimension 1 of leadership is self-leadership. You should know how to master yourself before mastering medicine. And the time management is very much important. It's non-negotiable. Time management is very, very important. That too, nowadays, I'm not able to see the balanced time management in most of the students. So you should train yourself to manage your time appropriately, and you should have balance between your studies and your recreations, and you should train yourself. You should have that mindset. And emotional intelligence that prevents the burnout. You should train yourself for that. And discipline beats motivation every time. So self-discipline, I usually tell my students, self-discipline and resilience are the two most important characters for every student. If you have these two characters, self-discipline and resilience, all the other things will come to you automatically. You need not going on chasing behind everything. So try to build your self-discipline and resilience. And you should acknowledge your own mental health. That's very, very important. Your mental health, you should take care of that. So you should be able to carry out busy schedules and high academic pressure, which may leave you very little time for development. So you should be able to manage all those schedules in time. You should be able to prioritize your tasks and set realistic goals. And again, practice emotional regulation. You cannot pour from an empty cup. So you should train yourself for all these characters. So you should become self-leader first before mastering your medical knowledge. So next dimension is your clinical leadership. So we have seen about self-leadership, what are all the characters you have to train yourself, and then clinical leadership. Next slide, please. So in clinical leadership, which is more important is timely and informed decision making. You should not panic and you should not hesitate to take a timely decision. And you should immediately take responsibility for outcomes. You should not fear of taking responsibility and balance expertise with empathy. And high pressure environments, you should be able to navigate, right? All these are very important characters for your clinical leadership. Timely informed decision making means so you should know the protocol for every disease. You should be familiar. You should make you familiar for all the protocols. You should update yourself. And also, timely management is very important. You should not wait for your seniors or mm, any DAS approval for important decision making in an emergency crisis. You should start acting immediately when you are waiting for your seniors to arrive or when you are not able to reach them. So there comes your leadership quality. So clinical leadership is to make strategic decisions that enhance care. It involves making informed choices and prioritize your tasks effectively. And the third dimension is team leadership. So we have seen self-leadership, clinical leadership, and now team leadership. Teamwork is very, very important nowadays. So healthcare is a team sport. It's like a team sport. And we should be able to respect all our co-workers and nurses and paramedics. We should give them due respect and coordinate diverse professionals. And we should be able to resolve the conflicts harmoniously and inspire them rather than commanding them. We should not command our subordinates or co-workers to make them work. We should be able to inspire them so that they will automatically work as a team. So teamwork is mandatory nowadays. So we have to coordinate nurses, technicians, and also our peers. And effective leaders, they resolve conflicts and ensure everyone to work cohesively towards optimal patient outcomes. So all of us, we will be having the goal of patient outcome. So we will be very eager to know about the patient outcome. So we have to work towards the better patient outcome by our teamwork. The next comes the ethical leadership. So we have built up a very good team. And now we need ethics in that. So integrity. Integrity means only when we were watched, we will be doing some good work. So even when no one watches, we should have that integrity. We should work as a leader or as a student, any category. So even when no one watches us, we should do the same work, diligent work, and we should be dedicated and sincere in our efforts. That is very important. That is integrity. And we should build unshakable patient trust. So if we have integrity, our patients will automatically trust us. And we should also refuse to compromise on morals. That is very important character. So don't compromise on morals at any situation. And one more point important is treat all socio-economic classes equally. Don't treat VIPs. We used to have VIP treatments to some patients, and some poor patients we will not care so much. That should not be there. So we should be an ethical leader. And also one more important attitude is we should be honest when we do something wrong in our decision making or anything in our clinical work, in our study, or in our day-to-day works. We all tend to do mistakes, but we should be honest in admitting our mistakes. So ethical leadership means prioritizing patient advocacy and empowerment. So we are keeping the patients first. It means providing the exact same standard of care to a paying VIP and a subsidized patient without exception. That is very important. That is ethical leadership. Next comes the communication leadership. Next slide. So communication leadership. Breaking bad news with empathy, active patient-centered listening, clear instructions to your team, educating patients, not just treating, bridging language and cultural gaps. So we should be an effective communicator. We should be able to communicate. Breaking bad news with profound empathy means, see, one patient is diagnosed with cancer, maybe stage 4. You should not go and say, you are having cancer stage 4. We cannot do anything. We should not say like that. So we should sit with them, talk with them empathetically. Slowly, we should make them involved in our conversation. Slowly, we should gain trust with the patient and communicate effectively. And slowly, you should, by grading, you should disclose his disease condition. That is very important. So we should train ourselves in effective communication. And also, whenever a patient comes to you, if they complains about their symptoms and signs, you should listen to them patiently. You should not simply ask them, what is your உங்களுக்கு என்ன பண்ணுது அப்படின்னு சொல்லிட்டு உடனே don't start writing prescriptions. Talk with them empathetically, and then give your suggestions or advice or prescribe drugs. And also it is very important to educate our patients also. So clear communication is the cornerstone of healthcare delivery. Next comes the academic leadership. So academic leadership means we should be lifelong learners. Lifelong continuous learning is very important in our profession, and practicing evidence-based medicine. So you should try to read updated journals. So one journal per week, like that. You start doing that. You start building that habit and engage yourself in medical research and start mentoring your juniors and peers and staying ahead of technology. So all these are important to have or to become academic leader. So engaging in research that cultivates critical thinking. True academic leaders share their experiences, guide their juniors, constantly adapt to technological advancements. So now All of you know AI. Telemedicine, it's already happening. Now AI has come and everyone is using AI for everything. But you should know how to judiciously use AI and where to use, when to use, how to use. That is very important. And next we can see what are the myths and reality. There are so many myths regarding this leadership. Next slide, please. So we have so many myths. Leaders are born, not made. But leadership is a cultivated skill set. It's also a skill we can develop. We can develop ourselves as a good leader. And another myth is leadership means having a title. It's not so. Leadership means taking initiative. You should take an initiative to become a leader. Leaders never show weakness. But in reality, leaders ask for help and mentorship. So all these are myths, what we have in our society. So many students think they cannot lead because they are not extroverted or don't hold an official title. Don't think like that. Even if you are not having an official title, you can become a leader. It's an ongoing process of continuous learning and creating opportunities. You should make use of the opportunities whenever you come across. Don't hesitate to take that opportunity to become a leader. And another thing, you should know the difference between a leader and a boss. Next slide. Leader and a boss. We should know the difference. So the boss always drives doctors and nurses and everyone around them. But a leader coaches them how to do their work. Boss always depends on authority. Here leader depends on goodwill. Always boss says, I do this thing, I am doing this. I will be doing my work. I myself alone doing this. Nobody helps me. That's what the boss says. But the leader always say whenever there is an accomplishment, the leader won't say I did this. He will say we did this. We as a whole team have achieved this accomplishment. That's what a leader, good leader says. And a boss tries to always blame others for all the mistakes. But a leader tries to fix the breakdown. Immediately, he acts on the breakdown. He acts what should be done next to solve that problem. And a boss always inspires fear, but a leader inspires enthusiasm. I hope now you will be able to see the difference between a boss and leader. But we have come across so many bosses, but very few leaders. So now you try to change the system. You become good leaders. In the wards, whenever you go to wards, ask yourself, are you demanding compliance or are you inspiring collaboration? You ask yourself. A true leader motivates their team, leading to improved performance and job satisfaction. That should be a good leader. Now we can see two scenarios. Next slide. So a critical lab value is missed in a hospital. So the intern shouts at the staff nurse, why is it missed? You did the mistake. Like that, we have come across this situation often. Now the result, the nurse feels humiliated and shuts down. She won't do the work. She won't do the normal work. So that environment becomes toxic. And there is a compromised safety in that situation. So here, what is the mentality here? The boss mentality and zero empathy. So next slide. Here, the code blue in the ward. All of you know code blue. I hope all of you know code blue. What is code blue? Right? Here in this situation, the intern stays calm, assigns clear roles. So clear communication is here. The intern says, sister, arrange for IV. And another technician, brother, fetch crash cart. So this is how you should be able to communicate with the co-workers and make the situation in a calm way. So the result of this situation, now the resuscitation is smooth and it is coordinated. This is how a clinical and team leader will approach any situation, whether it is crisis or normal or day-to-day activity. So this is how you should deal. So whenever there is an emergency, we should not fear or panic at what we can do. I am an intern, how I'll be able to do this. Don't panic. Don't wait for your seniors. Start doing the immediate resuscitation as per the protocol. Till your senior comes or the assistant comes or the professor comes, you start doing. So we should not blame others. Blaming others might deflect immediate fault, but it destroys the psychological safety of your team. Your teamwork will be destroyed. And the mistakes will be always hidden in the future. If we start blaming others for any situation, the mistakes will be hidden and ultimately harming our patients. Only if we know the mistakes, we can correct them and the patient outcome will be better. So from today, stop blaming others and start doing action with the calm sense. So now I hope you are able to differentiate between the two situations, how we should deal with the situations as a leader, because we all come across this every day. So next slide, we can see a Tamil Nadu rural healthcare scenario here. It's a mobile clinic. And here the challenge is the language barriers and tribal mistrust. So everything prevails in such PHCs, primary health centers, rural setup. So here the leadership action should be partnering with the local leaders. So we should have a good rapport with the local leaders. We should be able to communicate with them. Through the local leaders, we can communicate with the people, tribal people. And the result will be, you will be able to achieve increased screening for all NCDs and tuberculosis and everything. Even you can approach them for vaccination. So cultural humility is leadership. So we should be able to partner with the local leaders wherever we are. We should give a higher priority to that. So it's actually ECMC Velu's chat program, this one, Awardee Hills. So this shows us that leadership is not just in AC hospitals. It's about building trust, respecting tribal communities, and delivering care where it is hardest. This is how leadership should be built up. And next, I want everyone to know the role model story of Dr. V. Shanta. Everyone knows about her. She joined a 12-bed cottage hospital, lived on campus her entire life, built this 675-bed Adayar Cancer Institute. She treated rich and poor with equal respect. And she received the Padma Vibhushan and countless lives saved because of her untiring work and dedicated work. We should have her as our role model. one of our role models. She proved that care is a relationship, not just a procedure. She ensured 60% of patients received free or subsidized care, never turning anyone away. She is the ultimate standard of medical leadership, right? And I want to give some of the words of wisdom again. The next slide. So here you can see her, Dr. Shanta in her youth. So such dedicated personality. Next slide. So this is one of her famous saying. When the sick approach the gates of the institute, full of fear, weak in body and spirit, there is only one approach. One has to become part of them. That is her famous saying. Next. So whatever thy hands findeth to do it with thy might. That is a quote from Dr. B.C. Rao. And again, Dr. Shanta says, fear not cancer diagnosis, but its delay. So don't delay your diagnosis. You should lead your team to find the diagnosis, any diagnosis. So any condition, if it is diagnosed early, the outcome of the patient will be better. Next slide. Mother Teresa says healthcare is a human right. So in healthcare, we should give priority to empathy, listening to the patients, taking care of the patient. Our goal should be the patient outcomes. So high quality healthcare with care and compassion at affordable cost. This also you can bring by your leadership. You are the future generation, next generation doctors. So again, you should know a prescription cures the disease, but a leader heals the system. This is what we need now at present. Next. So now when you close your eyes for 10 seconds, you can think of the best doctor you have ever met. When you close your eyes, you may have a doctor's profile. What made them great in your eyes? Was it their textbook knowledge or was it how they made people feel? You may be able to find the answer, right? So only if they were empathetic, you will remember them, not by the textbook knowledge. Mere textbook knowledge is not enough. Next slide. So now the doctor India needs is a competent, compassionate, courageous, collaborative, and committed doctor. So you all become the competent, compassionate, courageous, collaborative, and committed doctors. You take the lead. You all take the lead now. Next slide. So these are the actionable habits for tomorrow. I want everyone to practice this. Now you have already joined a student organization. Already you are doing that. Now volunteer for a community service project and find a mentor whose values align with yours. You find a mentor yourself. Practice active listening with every patient and read one non-medical book on leadership. So these are actionable habits you can do which may make you a better leader tomorrow. I hope you will follow all these habits. You will try to do that. So leadership is a journey which begins with a single step, right? And communication and problem solving skills. All of you started doing this, I hope. The next slide. So now the closing thought you can give Medicine gives you the power to save lives, but leadership gives you the power to change the society. So don't just be a doctor, be a healer, a guide, and a pioneer. The future of Indian healthcare is in your hands. So try to become a leader. Your stethoscope is your tool, but your character is your true instrument. Next slide. So these are some of the journals you try to read whenever you get time. They have given focus on doctors who have formal leadership roles in regional collaborative networks. So collaborative work is very important nowadays. Regional networks of organizations and professionals are an important focus of public policy across the world. So read these journals. You will have an idea how to become a leader. This is very important. You should update yourself. Read a lot. Next. Next slide. So no digraphs analysis is okay. So some of the students will ask, how do I lead when I am just an intern with no authority? I have no authority when I am an intern. I should always depend on the seniors or depend on the advice given by the assistants or professors. Only that I can follow. So leadership is not about authority. It's about accountability. So the intern who shows up on time, communicates clearly, and follows up on patients, this is leading. Authority comes later. It will come automatically. So trust comes first. So even as an intern, you can lead the situation. Next. So just I thought of some questions students may ask. So how do I handle a senior who makes an ethical error? So document that first. Then speak privately, respectfully. That is very important. You should speak to your seniors respectfully. If unsafe for the patient, you can escalate through proper channels. So courage is a clinical skill. You should be able to handle that. You need not fear. Next. And again, some students may feel I am from a rural background and don't feel confident. Can I really lead? You have something urban doctors never will. You understand the patient's language, fear, and context. Since you are having that rural background, you know people better. That is the most underrated leadership advantage in Indian medicine. You try to own it, right? From today, start doing all this. Next. So you came into medicine because you wanted to heal. Now, today, I am asking you to add one more commitment, that is to lead. Next, how to lead. Lead your team, lead your patients with truth and compassion, lead your community with prevention, not just cure, lead yourself with discipline and humility. India doesn't have a shortage of doctors, it has a shortage of doctor leaders. So be one of the leaders starting tomorrow, not starting today itself. Next. Next slide. So I want to thank everyone. I hope I have fulfilled your leadership qualities. These are the leadership qualities I want everyone to have, all the younger generation, future generation, to have these qualities in you, develop these qualities and lead the system, correct the system, right? I hope everyone will follow. Thank you for your time and dedication. You try to build your network, find your voice, stay connected.
Thank you, ma'am, for that enlightening and powerful session. Your words have truly inspired us to reflect, evolve, and strive towards a purposeful leadership in our medical journey. Now, the floor is open for questions. So, if any of you have any doubts which you have to ask to ma'am, you can ask.
Thanks a lot for the wonderful session. And my question would be, being a student and being in any kind of student responsibilities, how shall we handle the student situation at the same time management situation when there has been disputes between the students and management? As a student leader, how should I approach it?
As a student, you can work in teams among yourself. So from the student life, from the beginning of the student life, everyone can become a leader by working in a team. Even in your studies, you can lead a team, right? Even in sports, you are going in sports. You will be participating in some competitions. There you will have a team. So when you inculcate all these qualities in you, wherever you go, you automatically will lead that. Right?
Yes, ma'am.
You need not fear. So I am a student. How can I lead? No, not like that. Every situation can be led by you. You become a leader at every situation. So it depends on the situation you have. You need not worry about the clinical scenarios. As a student, you will be facing a lot of crisis, right? You take that, you want that situation and try to overcome that.
Yes, ma'am. Yes, ma'am.
Ma'am, I have a doubt, ma'am.
Yes.
Being a leader myself, I just wanted to ask how to handle the overstimulation which we receive when we are being a leader. Sometimes it takes a mental toll on us, ma'am. So, how to handle it?
When you are a leader, right?
Yes, ma'am.
So you should develop emotional stability. That is why I put that slide. See, emotional stability is very important. You need not make yourself stress. You need not be stressed in any situation. எதுலையுமே stress ஆகாம try to be calm. So at this session, I want everyone to do yoga, to do meditation, at least for 5 minutes. 5 minutes meditation will carry you a long way. Meditation is a wonderful medicine. You can try to adapt it.
Thank you,
Meditation,
ma'am.
maybe initially you will have a lot of, what to say, a lot of thoughts coming to your mind initially. When you close your eyes, you will have a lot of thoughts. No problem, no issues. You let it go. In a week, you will be surely able to focus on one thing when you close your eyes. When you are focused, when you do meditation, you will develop emotional stability. Always try to respond to a situation. Don't react on the situation. நிறைய பேர்
Thank you, ma'am.
கோவப்படுத்துவாங்க நம்மள. நிறைய பேர் கோவப்படுத்துவாங்க. You would have come across. That's what you want to say, right? You are getting stressed out when you are a leader, when you want to
Yes,
lead.
ma'am.
That's what you are saying. கண்டிப்பா கோவம் வரும். But you should know how to balance that. That will come only when you develop the attitude of emotional stability. Emotional stability in the terms எல்லாம் கொஞ்சம் கன்ஃபியூசிங்கா இல்ல புரியாத மாதிரி இருக்கும். But once you start practicing, it will become habitual. Emotional stabilityன்றது ஒண்ணுமே கிடையாது. கோவம் வரும்போது you just close your eyes and think of this situation. You remove all your worries, you remove all your what to say, கூட இருக்கிறவங்க சொல்றது எல்லாத்தையும் நீங்க வந்து you should not take it to your heart. அந்த சிச்சுவேஷன்ல எது முக்கியமோ அதை மட்டும் கான்சென்ட்ரேட் பண்ணிட்டு you should focus on that one situation and move ahead. Right?
Yes, ma'am. Thank you so much, ma'am.
Ma'am, good evening, ma'am.
Yes, good evening.
Ma'am, I have a small doubt, ma'am.
Yes.
Ma'am, so while becoming a clinician, we would be in a situation to take a lot of decisions. No, ma'am, we have to take clinical decisions. We have to take treatment decisions. Likewise, we are having so many decisions to take. How to master the art of taking decision, ma'am? Because personally, I used to get over confused when just deciding to study a subject. So in that case, நம்ம எப்படி மேம் அந்த டிசிஷன் மேக்கிங் ஸ்கில்லை வந்து டெவலப் பண்றது?
Skill, அந்த skill எல்லாம் only you can develop by practicing. So treatment decision எடுக்கிறது, you should develop the skill. You should try to understand the protocol for that particular clinical condition, right? So ஒரு clinical condition na you should, whenever you study a subject, that is as students, படிக்கும் போதே you should have a clear idea. You should focus on a clinical condition. இப்பெல்லாம் நீங்க என்ன தப்பு பண்றீங்கன்னா, ஃபர்ஸ்ட் இயர் வந்தோனையுமே you started focusing on your NEET exam, next exam, NEET PG. You are not focusing on the subject at that time, right? Do you agree or not?
Definitely, ma'am. Definitely.
So you should, everyone should come out of that. You means I'm not pointing you generally in this generation, because that's also pressure given to you by the system.
Yes, ma'am.
Do you agree? The system is pressurizing you to be
Yes,
to become a competent, because so many competitions nowadays.
Yes, ma'am.
But even then, you should be focused on your studies. You should have a clear idea. Any clinical condition, try to update yourself about the protocol first. So if you are sure about, if you know the protocol very clearly, you will not have a hesitation in trying that protocol, right? So
Definitely.
even for COVID, even government is giving protocols nowadays, even for antibiotic prescription, because we are facing so many antibiotic resistant illnesses now. So antibiotic prescription also, they are giving a protocol. So you should be familiar with all the protocols. And then next one, what did you say? In decision making, one is treating, then
yes, a bit of very confusion, ma'am. இந்த டிசிஷன் பெஸ்டா இருக்குமா இல்ல இது பெஸ்டா அதுவா இதுவானா அந்த மாதிரி கம்பேர் பண்றது.
பெஸ்டான்றது அந்த புரோட்டோகால் தெரிஞ்சுக்கிட்டீங்கன்னா you need not worry about which is best. முதல்ல patient examine பண்றதுல you should focus. What are all the comorbidities the patient is having? நிறைய பேர் என்ன பண்ணுவாங்கன்னா, என்ன கம்ப்ளைண்ட் சொல்றாங்களோ அதுக்கு மட்டும் மெடிசின் எழுதிட்டு அனுப்பிடுவாங்க. That should not be done. Whenever a patient comes complaining about a symptom or signs, he is having the signs, you should fully examine the patient. Physical examination is very important. History taking is very important. After history taking, after physical examination, you will come to a conclusion or provisional diagnosis. Then add on to that, you will do investigations. Again, investigations, you need not do all the investigations. So whichever is important for that, if you follow a protocol, you will do the necessary investigations alone. Then you won't have any confusion, right? So
Yes,
you will be writing the investigations by reading the report. You should know how to interpret. So medical knowledge is very important. And acquiring that medical knowledge during your student period, then along with that, you should develop your leadership qualities. Like, that is your doubt, decision making. If you know the protocol, and you should know you will come to know the situation at that time, whether it is crisis, whether it is emergency, or we can wait. If you can wait, take an advice of a senior if you have doubt in following a particular protocol. You can contact a senior, but you should not hesitate taking advice from your seniors or from a colleague. That is very important. So building a rapport between your peers or seniors is very, very important. That's what a leader needs, right? You should have a clear, good rapport. So if you have a doubt in making decision, you can immediately contact your senior or whoever is close to you, and then you can follow that.
Thank you, ma'am.
Good evening, ma'am. Thank you for the wonderful session, ma'am.
You're always welcome.
Ma'am, like as a student leader, I sometimes face situations like where colleagues they create some unnecessary obstacles. Sometimes they are influenced by internal politics and some personal biases, ma'am. Like how to handle those situations, ma'am.
So always there will be internal politics, not only among students, even among faculty, even among professionals. Always there will be, you will be facing these politics wherever you go.
Yes, ma'am.
Right? Do you
Yes,
agree with me?
yes, ma'am. Yes, ma'am. Definitely.
We will be having such situations
Yes, ma'am.
in any of the positions we are holding. So
Yes,
that's where comes our emotional intelligence. I am repeatedly saying emotional intelligence. We should inculcate that intelligence in us to handle such situations.
yes, ma'am.
The emotional imbalance is always creating the problems. And we should not have egoistic clashes, and we should be able to admit our mistakes. That's one character which a good leader is having.
Yes,
We
ma'am.
should be able to admit our mistakes and correct ourselves and then lead the team. Then always they will understand your, once they understand your attitude towards them, definitely they will cooperate. You can have a coordinated effort.
Yes, ma'am. Ma'am, and one more, ma'am, like in certain situations, like leadership opportunities, they appear to be like influenced by some recommendations like presentation, face presentation, likewise, rather than merit alone, ma'am. Like as an emerging medical leader, like I feel uh, they are reducing my confidence, ma'am.
Yes.
Yes, ma'am. Like
So
how to handle
most of
those.
the students will be feeling that way. Most of
Yes,
the
ma'am.
students are having that. But always we in medical college, usually you will be having elections, no? Only by elections they will be taking.
Yes,
Not
ma'am.
like that.
Yes, ma'am. Sometimes by interviews and in that
Interviews, because they want to have a good, very good academic record. To become a leader, that should be academic record. Uh, though not perfect, it should be above some threshold. So academic record is very important. And then next one, the attendance, your attitude towards a critical situation, that also matters. So all these together will make you a good leader. But always, this we cannot eradicate. Only when the system changes, all these will get eradicated. This face presentation, because it's what to say, நம்ம சிஸ்டத்துல பொறையோடி போயிருக்குதுன்னு சொல்லுவாங்கல்ல, அது வந்து you all should change this scenario.
yes, ma'am, definitely, ma'am.
Can you?
Yes,
You
ma'am.
all students, you have started the network, right? It itself shows your unity. You have started the network. So you all should work coordinatedly. But because of that, you need not lose your confidence. You can lead in any situation. And in the particular situation, if you act provocatively and effectively, proactive participation is very important. Even if you are not given the leadership and the title kudukala kuda, if you act proactively in such situations, automatically you will become a leader, though not in the title. We don't need a title, right?
Yes, ma'am, 100%.
But when we act proactively, others will follow your decisions naturally. They won't follow the title winner. Do you understand my
Yes, ma'am.
point?
Yes, ma'am. Yes, ma'am.
So you need not worry about that. Don't lose your confidence. You should be confident that I am a leader. You should have that thought in you.
Yes, ma'am. Yes, ma'am. Thank you so much, ma'am.
Yes, good. So I am so happy that most of you are interactive and most of you are having so many doubts in leadership. So I hope all of you will become good leaders. And you can change this system, I hope. Will I be able to see the change the system by you?
Yes, ma'am. Definitely,
I
ma'am.
am 63 now. So will I
Sure,
be
ma'am.
able to see the new system?
Yes, ma'am.
Yes. Thank you.
Thank you so much, ma'am.
Thank you so much, ma'am, for your time.
Yeah.
Now I would request Dr. Rekha ma'am to share a few words.
Can I, Shruti? Can I ever? Am I audible? Shruti?
Yes,
Yes,
ma'am.
yes, audible.
Yeah. Yes, ma'am. Good evening, ma'am. As a true
Good evening,
leader,
good
if I
evening.
inspired us, ma'am, actually, I just wondered. They have asked so many questions, and surely they will follow your advices, and they will change the system. We can.
Madam, are you there?
Yes, ma'am.
Ah,
In between,
okay,
I'm
okay.
traveling, so
Yeah.
I thought
Okay.
I was
Okay.
online. Thank
Okay.
you very much for accepting our invitation and shared your knowledge in leadership quality. Thank you, ma'am.
Thank you.
Thank you so much, ma'am. As we come close to this enriching session, it is time to express our sincere gratitude. I now invite Ms. Darshini, Joint Secretary, IMA-MSN TNSB, to deliver the vote of thanks. Over to you, Darshini.
Thank you, Shruti. Good evening to all the distinguished dignitaries, respected faculty, dear colleagues, and future leaders gathered here today. I am Darshini, and it is my privilege to deliver the vote of thanks for this enlightening session on what it takes to be a leader, organized by the Indian Medical Association. First and foremost, I extend my heartfelt gratitude to our esteemed speaker, Dr. Josephine Latha Ma'am, Professor and Head, Department of Biochemistry, Srinivasan Medical College and Hospital. Ma'am, your journey, wisdom, and powerful insights into leadership have inspired us to redefine what leadership truly means. Leading with integrity, resilience, accountability, and vision. Thank you for guiding us beyond theory into real life leadership examples. I sincerely thank our respected patrons of IMA-TNSD, Dr. B. Sridhar Sir, State President, Dr. B. Sengutavan Sir, IMA Past State President, Dr. A.K. Ravikumar Sir, President-elect 2026, Dr. N.R. Tyagarajan Sir, President-elect 2027, Dr. M. Thiraviam Mohan Sir, State General Secretary, and Dr. D. Solomon Jaya Sir, State Financial Secretary, for your unwavering guidance and encouragement in nurturing young leaders within the medical fraternity. A special note of appreciation to our dynamic state team, Dr. R. Annamalai Sir, Chairman IMA-MSN TNSB, Dr. S. Jamuna Rani Ma'am, Co-Chairman IMA-MSN TNSB, Dr. V.S. Hariharan Sir, Chairman IMA JDN TNSB, Dr. Kannan Rajendran Sir, Convener, IMA-MSN SC. And also we have Arunagiri G, Convener, IMA-MSN TNSB, Ajay Karthik K, General Secretary, IMA-MSN TNSB, Bala Hariharan S, Co-Convener, and Hariram BJ, co-convener, for conceptualizing and executing this impactful session with dedication and vision. My sincere thanks also to the organizing team, Bala Hariharan S, co-convener, Parthasarathi S, joint secretary, Shruti Shivakumar, academic subcommittee head, Yashwanta Jagadishan, Elumalai, tech subcommittee head, and the tech subcommittee members Avinash R and Shri Nitin Raj S for ensuring the smooth and seamless conduct of today's program. To all the participants, your presence and engagement made this session meaningful and inspiring. As we conclude, let us remember leadership is not about position, but about purpose, not about authority, but about influence, and not about titles, but about impact. Once again, thank you to everyone who made this event a grand success.
Thank you, Darshini. On behalf of IMA-MSN Tamil Nadu State Branch, I thank our respected chief guests, our state leaders, office bearers, and every participant for making this webinar a meaningful success. Let us continue to lead with integrity, compassion, and courage. Thank you all and have a wonderful evening.
Thank you. Thank you, everyone.
Thank you, ma'am. Thank you.